Today we are going to talk about informed consent. إذا بتروح على المستشفى الأميرة بسمة أول مريض ما يدخل بتلاقي في نماذج موجودة، نموذج النيرسز نوت، نموذج الفيزيشنز اوردرز، نموذج اللاب تيست، الاكس راي، ومن ال5 6 ورقات هذول النماذج بتلاقي ورقة صغيرة تحت بتقول أنا فلان الفلاني أفوض إدارة المستشفى بإجراء كل ما يلزم لي. وبتيجي النيرس على المريض بتقول له وقع هون بدون ما يعرف على إيش بوقع. This is what's called the informed consent. الآن إذا صار خطأ أي شغل للمستشفى المريض ما بيقدر يطالب بحقه simply لأنه وقع وفوض إدارة المستشفى لإجراء كل ما يلزم. So this is what's called the informed consent. That is legally binding to you not to treat a patient without his informed consent. Consent اللي وقعوه بالأميرة بسمة. Informed consent means that you have to inform the patient what you are going to do for him. وبالتالي he is expected to be given a detailed information about his condition, lines of treatment, alternatives of treatment, and leave him to select what he choose as line of treatment for his case. You cannot force him to accept your treatment or your line of treatment without his informed consent. Now, typical example is a case with a breast cancer. Treatment radical mastectomy. Radical mastectomy means that you remove the breast and the axillary lymph nodes. وبالتالي we are going to. Now he was booked for, or she was booked for the hospital for surgery. Let us take the example, the second example, which is a patient, and you know the complication of diabetes, mainly renal failure. He went into amputation, leg amputation, and end-stage renal failure. He is not for kidney transplant. Now the treatment is chemotherapy for the rest of his life, but the patient asked to stop this treatment and the physician refused. In these two examples, we can see that the first one is we need the patient to sign to accept the treatment. And the second one, the patient is refusing our treatment. So there are two types of forms. One, he will sign that I refuse your treatment. The first one, he accepts your treatment. The importance of the informed consent is different in these two cases and becomes clear when the informed consent is not obtained. Now, let us assume that there is no informed consent in both cases. What happens? The first one, he accepts our treatment. Something went wrong, so he accepts this line of treatment. What is wrong is wrong. Now he cannot go to the court and ask for his rights. In the second one, refusal of his treatment. If you cannot secure a form that he is refusing the treatment, he can sue you and go to the court simply because you did not let him sign a paper that he is refusing your treatment. That is, informed consent is also of help for you as a physician when you practice your medicine to protect you from being sued. In case one, obtaining informed consent requires a provider to give all the information. So if you want him to sign to accept your treatment, there is a condition for that, which means that you have to provide all the information about his case, given that the patient is competent. Competent معناتها بالغ راشد عاقل. Competent معناتها عاقل. عاقل وراشد to understand the situation, thus provide an opportunity for the patient to be active in the decision-making process. By giving him the information, by giving him the alternative treatment, means that he is listening, he can comprehend, he can understand, and then he can discuss with you what's wrong with option number one, for example, what's wrong with option number two, what if this happened, what if this happened, which means that the patient is not just passive, listening to you or to your orders, but he is also active in discussing the case with you and to come to a line of agreement between the two of you. The informed consent doctrine play an important role in structuring a patient-provider relationship. So, because of this informed consent, now a new relationship between the patient and the physician appeared. You remember in Parson model, the patient has to go to a competent physician and follow his order. Follow his order means he is passive. Whatever the physician tells him, he has to follow it. And this informed consent means that there is a new relationship between the patient and the provider in which there is a mutual process of informing and discussing that lead to a mutually agreed upon a treatment decision. Without informed consent, this would not happen, and this new relationship between the patient and the provider is not going to take place. In case number two, where the patient and the provider are unable to agree, the patient and the physician ordered hemodialysis, and the patient sees that it is poor quality of life to submit himself for 3 times a week for hemodialysis, then they refuse the treatment, which means that both parties are in disagreement with each other. But we need to know that the competent patient has the full right to refuse the treatment as long as he is competent. Now, refusal of treatment means that you have to assess the competency of the patient, which is your responsibility, whether this patient is competent or not competent. If he's competent, he has the right. If he's not competent, then we need somebody else to take the decision on his behalf. Obtaining informed consent affirms the right of the patient to refuse treatment, but not to order it. Sometimes your patient comes to the primary healthcare centers with a sore throat, or what he needs is just Tylenol, or but the patient order that he needs antibiotic. Can you give him antibiotic? No. Why? Because the patient cannot order us what to do for him.